Okay. Welcome, Mia. Hello, welcome. I'm just going to give everyone a few minutes here to get checked in. Great to see everyone showing up. Welcome.
Hi, Mia.
Please let us know where you're joining us from today. We'd love to know. Oh. Okay. I think I might just give it maybe one more minute and then we'll get started. If you have any comments, please feel free to drop it in the chat. Okay. Well, hello and good evening, good afternoon. My name is Maggie and I am with Lupus LA and would like to thank you for joining us today for our webinar where we are going to be discussing family and caregiver support. Before we get started, I will have one of our panelists introduce our live interpretation option for us.
Hola, muy buenas, buenas tardes a todos. Gracias por sintonizar y bienvenidos. Y solamente les quería decir de que todo lo que estamos hablando aquí va a ser traducido en español y para obtener esos servicios de interpretación, por favor oprima abajo en la sección, si está usando una computadora, hay un mundo y ahí seleccione la opción de español. Y por favor también ponga sus comentarios de dónde está sintonizando en los comentarios para saber que está sintonizando y de dónde nos sintoniza el día de hoy, ¿verdad? Gracias.
Great, thank you so much. So I would like to welcome our moderator for tonight's event, Liz Marasso, who's been connected with us for many years, also a good friend and colleague of mine for many years. And I'm so excited to have our wonderful panelists here who I've known for quite some time. So I'm going to let you take it away, Liz.
Yeah, sounds good. Well, I want to welcome everybody. As Maggie said, I have been connected to Lupus LA now for, oh my gosh, like 12 or 13 years. And I also have known these beautiful women on today's webinar for about that same time. So I love I love doing webinars or any kind of events with these fabulous women, and I've learned so much about them since meeting them so many years ago, and just feel like today's going to be just a powerhouse of energy and people talking about their experiences as family and caregiver, but as well as patients talking about what kind of support was really helpful for them for their journey. So thank you guys so much, the panelists for coming, but I also want to really thank everybody that's joining us today for joining today as well. And we'd love to hear more about your experiences. Feel free to use the chat box for any questions, any thoughts. I'd love for this to be interactive as possible. I think the panelists would like that too, because this is really for you guys, for everyone there that has questions or concerns or is looking for thoughts from our awesome panelists that have been living with rheumatic diseases and lupus for many years, and also getting the support of their loved ones around them also for many years. I am a licensed clinical social worker that has been working in the health space for close to 15 years now. And I am also a lupus patient. So I'm coming to you guys today as a moderator that is coming from both a personal experience with lupus and rheumatic disease, as well as a professional that works in the health field, helping patients and families learn how to better navigate their diagnoses, better navigate how to use their social supports, but also helping families and caregivers of those living with chronic diseases and acute diseases to live optimally, to get the support that they need, be able to communicate their needs, and be able to utilize the support that they have around them in the best way possible. So I love that we're doing this webinar today because I really find that social support is so crucial in the journey of patients and their families, of people living with lupus and their families. And social support can look so many different ways. So it's not just about families. It can also be your support network. You know, a caregiver does not necessarily have to mean that there's someone in your family or a spouse or partner or parent. So although the panelists in this group are family, I also want to just put out there that this could also apply to friends or other people in your life that are serving as your support system. So I don't want to keep it only to families, even though that's the examples that we have today. As a clinician, I just want to point out how incredibly important support is for people living with lupus. I know from my personal experience, my parents played such an important role in my coping with lupus, living well with lupus, helping me navigate the health system, which we know is so complex. But as a professional who has studied and presented and put into practice theories around support and really looked into that and used that in a way that will help others. I know, and we know in our community that social support matters. Specifically for lupus patients, family support and social support has been shown to be improving pain, improving depression, which we know can affect our bodies both mentally and physically. Anxiety, it can help patients perceive less pain, so better cope with some of their symptoms. Family support has been found to help patients feel like they're more safe in their environments, that they can better advocate for themselves, that they don't have to remember all the complexities of their treatment, that they have someone that's there that can make sure that the right messaging and information is being reinforced to them. So there's so many very tangible things that social support and caregivers and family members offer patients with lupus. So I think that was really what brought us to this topic today, is really talking about how Estella and Juana have supported each other in their journeys, how Vanya and Edith have worked together as a mother-daughter, what that looked like. And I'd love for them too to not only address what worked well, but maybe even some challenges that you guys faced in your relationships. Because we know nothing is perfect. So I want to really validate that this is social support and family relationships and any relationship has its complexities. And I want to validate that for everybody that is on this webinar, that it's okay to have some bumps in relationships along the road. But when we acknowledge that and think about what's working and what's not working, I think that's how we build the best relationships, is acknowledging it, communicating it, and moving forward so that everybody knows what the best kind of support looks like for the patient or person living with lupus. So I'm putting that on you guys kind of for homework for today's webinar to please address. I think that would just be a neat thing to add. So I'm actually going to jump right in because I think our panelists have so many awesome things to say and share. So I think we'll start with some introductions. Juana, do you want to start? Kind of putting you on the spot, but do you want to start?
Thank you, Liz.
About you.
Thank you, Liz. Hello, everyone. My name is Juana Mata. I was diagnosed with lupus in 2009, right after being diagnosed with rheumatoid arthritis. I share my personal story because I want to empower others on the importance of self-advocacy and taking care of everyone, or of our overall health. And like I said, I was diagnosed with lupus in 2009. And after my diagnosis and going through many struggles on trying to find out what was wrong with me and talking to my doctors, I was diagnosed with lupus due to low platelet count. And my advocacy has helped me initially. And that is the reason that I am alive today, because if I had not advocated for myself, I would not be here today. The day I was diagnosed, I was dismissed by the doctor. I was told that I looked fine, that I could go home. But my insistence and my persistence and knowing what was wrong with me is what saved my life. The day I was diagnosed, my platelets were at 2,000. Normal count of platelets are 130 and above. And because my advocacy again is that I am here alive. And that's one of the reasons that I talk and share my story so that others also learn to not only advocate, but to know that we are, as patients, have the power. We have, we can, as patients, talk and make sure that our doctors listen to us. And that's a little bit about me.
Great. Thank you so much, Juana. I so appreciate it. I totally forgot to mention, the chat is there for you guys to ask questions. I think I said before, I would love to be as interactive as possible. So any questions or thoughts you have, please feel free to put it in the chat. And I will try my best to make sure that your questions are answered appropriately and in the time that we have for today. So feel free to use that chat function. Awesome. Thank you so much, Juana. Estella, do you want to tell us a little bit about you?
Yes, so I am Juana's sister. My name is Estella Mata, and I'm one of the co-founders of Lupus for Lupus as well. So kind of like a little bit of what Juana was saying is what brings us here today. Juana was diagnosed with lupus. We did not know much about lupus. We didn't know about treatments. We didn't know about support. We actually felt that there was not a lot of support anywhere, very little information out there, and zero information in Spanish. So when someone gets diagnosed with lupus or a chronic condition that you really don't know much about, in 2009, there were no FDA approved treatments for lupus. And there were a lot of treatments that, were offered, but we didn't know how Juana was going to react, or we didn't know what other symptoms were associated or how severe this could be. And when we found out that this could take her life, we were scared. but not just scared about the diagnosis. We were scared of the unknown, of not knowing. So for us, her diagnosis didn't just impact her, it impacted the family, loved ones, her children, and us as siblings, and specifically my mom. My mom, again, she doesn't speak English, so we needed resources in Spanish. So it was more of a discovery of what can we do as a family? How can we support Juana? How could we support one another? And how then can we support other families that are dealing with something similar like we are? So that is how we started on Looms for Lupus. And what we do is we support those living with lupus and overlapping conditions such as fibromyalgia and obviously mental health. And in those support groups, we wanted to incorporate everyone, your chosen family, which are your friends or those that support you, your loved ones, your family, your direct family members, whether they're your children or your significant other, and your siblings. So anyone that supports the person that lives with this condition. So for us, it was really more about, let's see how we can support one another as well, because lupus doesn't just affect the person, it affects everyone and even the community, because Juana is a social worker, so it impacts the community as well and the services that she could be rendering to others. So that's really how we started our journey. And I think today it's so important to have this conversation about what is support and what does support mean to the person living with lupus, and what does support mean or what is needed for those that care for and or love those that have these conditions. So I'm excited to be here, Liz, and Vanya and Edith, to be here and share our journeys, because it is a little bit different from a sister perspective than for a mom perspective. So I'm excited to be here. So if you guys have any questions, please type them in there.
That's great. Thank you, Estella. And you brought up such an incredible point around access to information. And that might look different for different members of your social support network. So you mentioned, your mom needs, information is, of course, she wants information on how her daughter's doing and what's happening to her daughter. But then there's, potential barrier, a language barrier, and you want her to have that information to be able to provide that support. But that might look different for different members of your support network. That's a great point. Awesome. Vanya and Edith, do you want to tell us a little bit about you?
Okay, so hi everyone, my name is Vanya. I was actually diagnosed with systemic lupus when I was just after my 10th birthday. I'm now 27, so I've been living with systemic lupus now for 17 years. I was diagnosed back in 2004. I started having symptoms right away after my 10th birthday. And at the time I was very into tetherball. And the first symptom I got was arthritis, but we thought that the pain I was experiencing within my hands was the tetherball because I was playing so much. I was playing at school and at home. I actually got one for my birthday. So we dismissed it as that as just, oh, pain, she's playing too much. The pain persisted, and just like other stories we have heard before, I was dismissed by doctors and pediatricians. Oh, she's just lazy. Oh, she just doesn't want to go to school. Oh, the fever is just whatever. But my mother knew something else was going on. I stopped eating. I stopped watching television. I stopped having interest in cartoons and my toys, and I just stopped living my life. Right away after, one doctor decided to see me after hours. He was kind of seeing us in secret because he heard how bad I was. He took a look at me, and right away he knew what it was. He told my mom, "This is lupus." My mom was like, "What is that? Like, can I have medicine for it?" And he was like, "Oh, no, honey. You need to go to Children's Hospital right now or she won't make it." So we went to Children's Hospital that night, and they took us in right away, and they were like, "Oh, thank God you're here. She is deadly sick." They saw my kidneys, they saw the inflammation. It was very bad. They started putting tubes and medicine into me. Within a week, I started responding very well to treatment. But the day before we were supposed to go home, I had a horrendous seizure that left me in a coma for a week. This coma wiped out my entire memory. When I woke up, I looked over at my bed. I saw this lady. I didn't know who she was. She was my mother. I had forgotten who my mother was. They asked me, "What is your name?" I said, "I don't know." At 10 years old, I had to be potty trained again. I had to learn how to walk, how to talk, let alone learn timetables, learn how to do stuff that I was expected to know how to do to continue school. So from then on, I had to just relearn everything. I had lost a lot of weight, so I had to relearn how to just regain that strength again. From there, I mean, I continued school at home as much as I could, but like I said, I've had the support of my family from the beginning. They have been my strength from the beginning. I could have not made it through any of this. As you've heard my story, I was at the lowest and I've come out from the very top. I'm now 27. I finished college. I am now an infant therapist and I work with the underdeveloped children who also need help. So now I'm in my own small way giving back to other children who need it. So that's a little bit about me. And this is my mother, Edith.
Hello, everyone. Well, Vanya's diagnosis has been one of the most changing life experience for myself and our whole family. But the outlook for this diagnosis for myself is what we can do to make things better in our life. With this diagnosis, it was devastating, to say the least, because we didn't know what even was lupus at the moment. But the only thing that we care is how to make her feel better, because we saw her suffering for 3 long months. For us was the longest 3 months. And I know that for other patients it's years. And we felt so blessed it was only 3 months. And even though we struggle with, finding the help during those 3 months, because I kept going almost every day to the doctor's office to seek help, because almost every day was something different. There was, she was not feeling well. So it felt so long, but I know that it wasn't a long period of time compared with other people that suffer for so long. By the time that we got to Children's Hospital, things moved so fast. They're great hospital doctors, great nurses, therapists, social workers. I can't speak nothing bad about Children's Hospital. They saved our family, her life, and taught us so much and give us the support that we need at the moment. They connect us with so many institutions that we need so much information about lupus, because we were like, I don't know what it is. How I couldn't even, I think, comprehend what was lupus at the moment when she was at the hospital. I was just living hour by hour. That was the truth. I couldn't even think about how the next week is going to look like. It was so much going on, and more or less how her future could look like. But once we got out of the hospital and we came home, it was scary to be alone, taking care by myself, to get so many therapists. She has so many things that she needs to work on, going back to regular school, even though with special education. It was overwhelming, and not even thinking about the amount of medication she was on. Seriously, at times I cried just trying to put the medicines on her little boxes, and I couldn't even do it. I have to stop for a minute, you know, go do something else and then come back and finish it up. But the only thing that I think help us is people who love us came and, you know, give us love. They couldn't, you know, cure her or make her feel better, but love us and say whatever you need, how we can help you. We're here. And sometimes I couldn't even tell them how I felt because it was raw. But just knowing that someone was behind you and trying to, you know, be with you at the moment that you need the help. That was one of the things that I think keep us going. And is I'm saying is this experience has been life-changing, and I don't regret any of the experience that we have going through, because make us who we are, and we always try to pass the love that we receive in the past to whoever needs it. I remember way before we got connected with support groups, I was like thinking how my little girl is going to be later in like 5 years, how this is going to look like. So somehow I think a social worker from the hospital gave me a phone number of a mom of a girl that had lupus, and when she was little or younger, and now she's in a college, and I want to talk to her. I want to hear her story. I want to see how she's doing. And I never saw her. I never met her personally. I just have a conversation with her over the phone, and she was so grateful, and you know, she gave me her time. And I asked her like a million questions, and I kept asking her, "Are you okay? Are you able to do this and that?" And she's like, "Yeah, I'm fine. I'm doing this. I'm going to school. I'm doing everything. I'm looking for a job now. I'm managing to go to college and having a part-time and stuff like that." So it blew my mind, like, wow, it's possible. My kid has hope, right? I know I believe in God, but it was so overwhelming at that moment that I was like, I just want to hear one person that made it to the other side. So I know it's possible. And I'm going to, you know, help my kid to get to that point. So I remember that conversation, and it was one of the most impact me. That girl doesn't know how much she helped me, because it was very important to have the conversation with someone who already have been through that. So I could picture that, and support is vital.
Yeah. Yeah, I love that, Edith. It's the validation, you know, someone validating that hope exists, that it's possible.
Yes.
Yeah. And one thing that I heard from Estella, I heard it from you, and Edith, I heard it from you too, where it was like, who knows what lupus is? Like, you get this diagnosis, but not only do you not know what it is, but then what is the next step in finding information that's helpful for you and your family? You know, not just for the patient, but also for family and support network that's trying to provide support to that person. And I'm just wondering, how did you guys go about finding out information that would be helpful for your families, so that you could provide support that was most helpful to your loved one?
You're muted, sister.
Sorry. I can say that for me, at the beginning, when I heard the word lupus, it didn't really mean anything to me. But when I did see Estella's expression, when the day I was diagnosed, Estella was with me, I saw her expression. So that I was worried more for her expression, not so much about what lupus was. I didn't even realize that I was critically ill and that I was going to be put in ICU for 7 days. to me, it was like, oh, okay, I have lupus. So what's next? What medication am I getting? So for Estella, for her right away, it was just looking and searching for the information. So for me, the support that I received from Estella and for her to provide the information, she has worked in the medical field. She's not a doctor, but she's worked with doctors. So she knew where to get the information. Not everyone can. And it is, again, back in 2009, there was very little information. And like Estella said previously, there was no information in Spanish. And that's where I actually went. I went to look for the information in Spanish and I found nothing. So I was like, okay, but Estella, explained it to me, and it took a few days for me to realize that that there was no cure for lupus. There was not much that I could do to even help myself. But, I was blessed to have Estella and for her to provide that information to me. And of course, but it is important for us lupus patients and our loved ones, family members, to know what lupus is and to understand how it impacts not only our bodies as a lupus patient, but how it also affects our families and the side effects of the medication, because a lot of the times the side effects of the medication, for example, prednisone, tends to make us a little moody, or times where we can't even sleep, so our mood changes and everything. So just looking and finding for that information, or that information about lupus. And again, I was blessed to have Estella and for her to share the information with me about what it was and how I could start helping myself.
So it sounded like, Juana, that it was really nice to have someone else kind of do some of that work while you were processing what the heck was going on with you. It was nice to have someone else kind of doing some of the research around what does this look like for you. Definitely.
Yes. And again, I was blessed to have her by my side. And I mean, Estella and I have been very close since we were little, but just having her on the day I was diagnosed and having her support and her being there, I felt okay. I knew that I was going to be okay, just because I knew my sister was next to me. She was there not only to inform me, because I mean, when you get diagnosed with something, with any condition, especially lupus, you don't know what's going on. You are confused, especially if you've never heard the word lupus. Sure. So just having Estella next to me and explain to me what it was, that made a big difference.
Oh, I love that. I love that answer.
And I'll add on something, Liz, really quick.
Sure.
It's true. I think hope, and I think Edith said it really good, not knowing and having that glimmer of hope. How do you continue to move forward? What's next? What can I do? What should my daughter do? How can I get her the help? Because as loved ones and caregivers, we want to fix things, right? We're mothers. We want to do the fixing of everything. We want that little magic wand to take everything away. The reality was, lupus had no cure, and there were no FDA approved treatments. So we needed to figure something out. And the first thing was, let's learn about it. Let's learn about what is out there, and let's see how we can learn and empower each other, because lupus is a condition. It's just a part of you. It should not be your whole life. So there are other things to worry about. There are, are you going to be able to walk? Are you going to be able to work? Are you going to be able to go to college? Are you going to be able to do the things that you are used to doing, or what you are supposed to do? And so for us, it was like, let's navigate it on our own. Once we kind of figured out how to do it, and we knew that we needed to share that glimmer of hope with others, that's why we started, knitting a community of hope, and also developing tools where we can empower the individuals to use other modalities to relieve the stress, which is what causes a lot of the flares and ignites that lupus in your body and starts attacking itself. And I know Dr. Monica was asking, or on the chat there, what's the elevator pitch? So for me, I think Lupus can be described as an autoimmune condition. It's basically your body attacking itself and attacking anything that's vulnerable at that moment. And I think if we explain it like that, it's actually, even though it could be aggressive, like knowing that, you know, there are ways to calm those flares down. There's a ways to kind of minimize those flares to, you know, impact your organs, whether it's your skin, your lungs, your heart, your brain. I think it's important to know that stress does trigger a lot of that. And as far as the glimmer of hope, the support groups, I went to first support group for Lupus LA. And that's what gave me the ability to understand how important it was for us to start providing our own support group for the caregivers in Spanish, bilingual, and incorporating all these other modalities, and also sharing and information, because it wasn't just about lupus, it was about navigating healthcare. It was about learning coping skills for the loved one and for the individual living with a condition. So Lupus LA was the first support group that I attended. And that is why since then, and almost 12 years ago, I have been with Juana dedicating ourselves and partnering with Lupus LA to provide the wonderful support groups that are needed for the community, for everyone in different languages, because that is what is needed. We need that hope.
I love that. And I want to tie in one of the comments in the chat from Carolina, who mentioned she goes to the support groups, and it sounds like the support group has allowed her to reflect on, what does my social support look like? Like, I might think that everything looks great, but maybe hearing from other people who are having similar challenges or are talking about things that are working well for them that maybe she's not having, or just, you know, or look different for her. It sounds like a support group really helped her reflect on what that looks like. And so Carolina, I love that, that, you know, whatever it showed you, it still was a place where you could reflect around what that social support might look like for you and what your needs are. Vanya and Edith, how about you guys? What do you feel like? Let's see, I'm trying to think, you know, how upon diagnosis, Edith, what did you think was most important at the time of diagnosis? You know, you mentioned that it was kind of like information overload, but you wanted to get that information so you could better take care of Vanya.
Yeah.
What did that look like for you?
They at the hospital, they were very helpful, and they give me all sort of informations and resource, and it took me a while to be able to go through the whole, you know, sort of things that I have to look at and learn and understand. But once I actually learned what it was lupus, what I noticed that I stopped being afraid of lupus, because not knowing what it was making me very fearful.
Oh, of course.
Because I saw what it did to my kid, and you know, it's the nightmare. It's the worst nightmare for a parent, and like, we want to fix that, and there's no cure. So it was frustrating. It was a lot of feelings that was not positive and helpful. But once I learned what it was, and there was treatment for it, and yeah, with time things can get better, and she can get a normal life. I thought, okay, so we can do this, and I put it in perspective that if I control my fear with knowledge, I'd be able to move forward. Where I was just, you know, just thinking about all the things that probably she couldn't, you know, do in her future, and that was not possible.
Sure. So once you have information, you're able to move forward with it and do something with it.
Yeah, exactly.
Yeah.
And that helped me accepting the fact that I can change. lupus. And that was a big thing for me, accepting that she has a chronic condition that means that she's going to live forever with it until it's a cure, if God, allows that. But for now, she's, she has a normal life, as everyone suffers some sort of, thing, sometimes it's allergy, sometimes it's other stuff. And, we're humans, we're imperfect.
Of
So
course.
we do what we can with the bodies that we have, and we need to enjoy life as it is.
Yeah.
And we go up, we have ups and downs, but I think information is vital too,
Mhm.
what it is and how you can help your loved one that is some
Right.
sort of like condition,
Yeah.
and just keep going. There's
I love that. Juana, I know that you and Estella and Vanya, you have a sister too, and I'm kind of thinking about maybe how this impacts the entire family, like siblings. I know that the Matas have, a larger family, and Vanya, you have Diana. So I'm just wondering, what does that maybe look like? Like, what does the engagement look like with your siblings? How has it been, as having other people in the family that also need attention and support? What does that look like for you guys?
I think with our family, we had to make a lot of changes after my diagnosis. Not only, they were always nervous about, my condition. And for example, like going on outings, my father, my mother, we always used to go out to the beach, to the mountains, to the park. I mean, we would do a lot of outings now. That has to be limited. I am very sensitive to the UV rays. So a lot of changes, a lot of accommodations we had to do so that I can still be part of the outings. So my family, Stella and my children, we started, instead of going to the beach at the, in the middle of the day, now we would go more towards the evening. We would still have fun. We still do a lot of things together, though a lot of the things that I do are limited. For example, we usually go to on vacation to a beach, and we stay there for 7 days. My Estella and I and a lot of my kids and a lot of my nephews and nieces, we wake up at 5 in the morning or 6 in the morning, and we go really early to the beach to have fun. And then we go back to where I'm not going to be exposed to the sun. And then we come back again, we come back out again to the beach after 6 o'clock. So those are a lot of the changes that as a family we had to make. With my children, they were playing sports when I was diagnosed. So now I had to make sure that I had an umbrella. I had, I always had something to protect me. I was still able to do a lot of things, but we do have to make a lot of changes within our family. Even before the pandemic, when somebody was sick, from the youngest nephew or niece that had the flu or had a runny nose, they were like, oh, don't get close to auntie because I'm sick. So, or, I would wear a mask, or the kids would always stay away from me. So a lot of changes were made within my family because they knew that I wasn't doing well.
That's so nice to know that you can still participate in things with your family, but that they love you enough to be able to make accommodations for you and make it work for you. That must be actually, I know it's such a beautiful feeling to know you can still participate in something, even though it might look a little bit different.
Yes.
That's great. That's great. And I'm wondering too, Edith, I'm kind of thinking, especially since you have, there's Vanya, who has had health challenges, and then you have another daughter as well. How do you navigate helping Vanya work towards her independence and doing things on her own, which might look different than what your other daughter's needs are?
Yeah, it was hard because I think that instinct as a you know, parent is to protect and
Mm,
want to do everything for them even more because you know that they have some sort of a disadvantage or they
sure.
need extra help. But that's, I have to say, the doctors at Children's were so good at, you know, explaining how important was for her
Mm,
to become independent. That, you know, even though it was hard for me, I have to let go and help her to become independent because I knew that, yeah, I want to be with her. I'm still with her and support her in any way
mhm,
I can or she needs me, but I want her to be out there doing what she wants to do with her life. And if I didn't start early enough, helping her, making sure that she will be able to do it on her own when, you know, was the time, she will suffer. And I didn't want that for her either. So it was hard as a mom to let go and help her, you know, starting with the medications, like you're responsible, you know, if you don't take it, you're going to pay the consequence. You're the one who's going to suffer. And when you suffer, everyone suffer. So think about that. So, and she's very conscious about, and obviously she always will say to me, I don't like the medicines. And I say, I agree with you. I don't like it either, but it's important for you to take it to stay, you know, healthy or to stay able, so you'll be able to go to school or to function. And she was like, okay, and she will take it. And I said, okay, that was a great conversation because it's okay that we don't like it, but you still have to do what you have to do.
Sometimes I would hold up my prednisone and we would be like, we don't like you. And then I would take it just to let out our feelings. Just, we don't like you, but right now I need to take it. So, okay.
I love that. That's
Our
so funny.
bonding moment, we both didn't like it
Yeah.
because we knew how crazy I felt with it. But we would just be like, we don't like you. And I'd take it.
Yeah. And you know, it is not an easy thing, but you know, I try to follow a lot of the, I know they're doctors and they have seen so many patients and they help so many other patients to go through the same things, and the things that make sense to me, you know, I follow their instructions and try it at least. And other things that I didn't, you know, I didn't agree, I would do what I think it was the best for my children. But most of their advice were very good, and so I followed that, and they help us go through the transition to go to what is that called, when they get out of the children's care to adult care. That was a whole nother experience. That was the hardest part when you're not part of it at all. And let her see, you know, go do her own appointments and take her own decisions. And I was just like, yes, if that's what you want, I'm with you. And that was still hard, but that's my job, just to be supportive.
Mhm. I love that, Edith. Thank you. I want to, there were a few questions and a comment in the chat about the need for support for oneself when you're a caregiver or family member. That when you don't have a good support system, what a great way to kind of fill your cup so that you could be your best self for someone else. My thought kind of immediately goes to, do you have your own neutral space to be able to express yourself, to get feedback, to share your thoughts and feelings in a way that you're not going to get, you know, judgment back on, where it might be just a safe space for you to talk about frustrations of being a caregiver or parent or patient that's trying to navigate, you know, talking with their families or dealing with their families or caregivers. So I just want to put it out there that I think one-on-one support, finding a good therapist, as well as a support group that really feels safe to you, is a great way to find a good support system, to get time for yourself so that you could better care for and be your best self for those that you're providing support for. So I highly encourage everybody to do that. And if you're not sure of resources in your area, you can always contact Maggie at Lupus LA. She has some wonderful resources. And I just want to thank our panelists so much. This was so helpful to me, and I know therefore helpful for so many people. And as always, I love talking to you guys about your relationships and your journeys, and sharing, being able to share that with other people. I want to turn things over now to Paula White from GSK, who's joining us. Thank you so much. And Paula has offered Lupus LA and our community so much support over the last few years. So I want to turn it over to her. And yeah, thank everybody again for their comments and questions and for participating.
Thanks, Liz. Paula, just real quick before you head on, I'm just going to go ahead and just quickly wrap up to what you just said, Liz. I'm going to go ahead and put in the chat our links to our Facebook pages as well as our support groups, and thanking everyone again for joining us. And Paula, I'm going to go ahead and shut down and give.
Okay, thank you so much, Maggie. If you could, I am disabled actually as a participant from sharing. Let's see. If you could just enable me. Okay. Okay, I think I've got it. Thank you, Maggie. Okay. Are you able to see my screen? I'm sorry.
Yes, just put it in presentation mode.
Perfect. There we go. All righty. Thank you so much. Boy, what an amazing conversation. What I have to share with you, coming to you from GlaxoSmithKline's Us and Lupus program today, is really going to round out the discussion that you all have partaken in thus far and really emphasize or re-emphasize some of the ideas that were gained from Vanya and Edith and Juana and Estella. So I am a patient engagement liaison in the western part of the country, and I simply do education surrounding lupus for patients. The Us and Lupus program is a program that was really put together by folks, lupus warriors. Estella and Juana were part of this, but it is a resource that I will give you access to at the end that you can go as patients and caregivers. A click of a button, you can change the language to Spanish for the entire website, but you can learn to more about your disease and learn more about being a caregiver or loved one of someone that is suffering from lupus. So I don't have a lot of slides to share with you today, but I wanted to go through, and again, a lot you'll notice is going to reiterate some of the conversation that's been had. Make sure that you understand that the discussion that we have does not replace any conversation with your doctor. And a few points I want to touch on quickly are going to include educating yourself. I heard Edith say that earlier. It's important that you learn to manage your lifestyle with chronic illness lupus. Learn how to communicate with caregivers. I heard that multiple times. Learn how to communicate with your healthcare team. And then we'll talk about some quick tips as caregivers, because the caregivers need care as well, and love and attention as family members and loved ones that are helping to care with someone in the family with chronic illness. And again, I'll end by sharing access to the support services for caregivers on the Us and Lupus website. So as I said, first, education. It's important to know you're not alone. You can get in with a therapist, but understand in the United States, 6 out of 10 adults actually have a chronic illness. I know Edith mentioned, some people have allergies, right? And everyone has something, it seems, but 6 out of 10 adults in the US do suffer from chronic illness. Of those that suffer from chronic illness, 4 out of 10 of those actually have more than one chronic illness that they're suffering with. So lupus, yes, is a chronic illness. It is lifelong. There is no cure for lupus. And the inflammation can cause pain in various joints and organs within the body, and does affect our entire bodies. So with no cure, it's important, we'll talk about this, the importance of managing symptoms and being able to share your feelings surrounding those symptoms with your healthcare team. 9 in 10 lupus patients do happen to be female, by the way, but we do have males that have lupus, and I've had some in support groups as well. So lupus can be unpredictable. Every day is unpredictable. Someone that visited the Us and Lupus website quoted the cycle of flares and remissions within the chronicity of the disease are hard to anticipate, but we'll talk about some of the ways that you can perhaps control some of the symptoms that you're having, and hopefully in turn, maybe lessen some of those flares. Symptoms can go on for, day after day, and various activities or triggers, if you will, we'll look at, can cause you to have an increase in symptoms. It can change over time, and every lupus patient's journey is different. Your level of your illness and the frequency of your flares is for you to own, and may be different than other people that you communicate with in support groups as well. So lupus can cause changes in various organs or long-term organ damage due to that inflammation occurring over and over. It can damage some of the tissues of those organs. You see there on the right, brain, lungs, heart, muscles, kidneys, skin. Some of you on the line today may identify with some of those areas of organ involvement. The important thing is to understand when you begin to have newly identified symptoms, and to share that with your doctor, to be upfront and proactive in letting your doctor know if you're starting to have any symptoms. Don't ever say, oh, I don't know if this is my lupus. Run it by the doctor, because you want to make sure if there's anything going on in your body, that you make sure that it may not be, or that it's not related to your lupus, and clear that by your doctor. So managing the lupus lifestyle, as caregivers and patients on the line, it's important, as I said, to track your symptoms. Loved ones can help you write down how you are feeling, get prepped for your visits maybe a few days before. If they notice anything that you're having conversation with as questions that might come up, they can help you jot down those questions to make sure that you have them with you when you head off to the doctor's appointment, and you don't forget anything that you were hoping to ask. So some of the symptoms you may look out for, and this by no means is all of them, if you're having any muscle pain, joint pain, any hair loss, any vision changes, changes in your level of fatigue and skin symptoms, any fevers or night sweats, chest pains. If you notice you're beginning to have sun sensitivity, maybe that's something you didn't have before, any memory problems, brain fog, that type of thing. Those are just some ideas of symptoms that you may have at various times that you'll want to make sure to document the frequency, document the severity. So when you go in for that appointment every 3 months with your rheumatologist or whichever specialist you may be seeing, you're able to share those symptoms with them, and you don't forget, because maybe that day you happen to have that appointment, you're not experiencing some of those symptoms, but you want to be able to give them a clear picture, right, of what's been going on since you've last been in their office for a visit. So some of the triggers I mentioned, stress, I know I heard that talked about, managing stress, nutrition, sun sensitivity, changes in sleep, not getting enough sleep, medications. You need to make sure that if you are having any symptoms with medication changes, you let your doctor know. Again, run those by the doctor. Illness, injury, anything like that can trigger symptoms and flares. I remember Vanya mentioning the medication she took and how she would comment to that medication before she took it. If there are any difficulties that you're having even taking medications, mention that to your doctor, because you want to make sure that the doctor's aware if you're having problems taking medicines or if you're experiencing any side effects before you make changes in your treatment. So in managing stress, I know there was some ideas talked about, but help your loved one maintain an appropriate social life and schedule so that you are having enough time, downtime, if you will. You know, get others on board to help do things around the house before becoming overwhelmed, to help with some of those chores and activities so that you have enough time to fit in, you know, time to relax, maybe time to get exercise. I know Juana mentioned getting out with her family and still exercising, not taking that love of activity out of her life, but adjusting her life as to how she and her family could still take part in that exercise and activity together. Managing and monitoring your nutrition, planning your meals, making healthier choices. A dietitian is someone that can get involved. Pay attention to the foods you eat. Sometimes foods that you eat and dietary habits can trigger changes in your lupus symptoms. So if you notice that, sometimes a food diary is great to have in your journal as well. We talked about this already. I know Juana talked about sun safety and avoiding certain hours. So do that. Make sure you've got a good sunscreen that you are using and that you reapply if you are going to be out in the sun, or that you wear a good skin covering. I was taking part in a lupus walk event this weekend here in Arizona, and I just loved that I saw people with sunscreen and hats and sleeves on. So make sure to do that, but still get involved in those things that you love. Sleep, so important. We know the fatigue with lupus is above and beyond, right, the normal level of fatigue that people say, oh, I'm tired. No, this is, you may have slept 8-10 hours, but you still are experiencing fatigue. So if it's possible, take naps on days that you can, maybe on the weekends when you can fit them in, and make sure that your schedule is not locked so tightly that you're able to have a good bedtime routine and regimen to assure that you're getting ample amounts of sleep on a consistent basis. We're going to talk a little bit about health management and managing that healthcare team right before we finish up here. So this was a survey that was done by GSK, and one of the things that was realized in talking with doctors and caregivers and lupus patients, they discovered that many patients struggle to communicate with their physicians. And I heard the word empowerment earlier. I hope, if nothing else, that I empower you to get education, to communicate your needs, and then communicate those needs back to your caregiver. 61% of patients will minimize their symptoms to their loved ones and their caregivers, and 76% of physicians actually said that their lupus patients are having difficulty communicating their needs of support, not only to them, but also to their loved ones. So sometimes it helps, again, you want to write things down so that, one, you don't forget, but that when you get to the office, you're able to communicate that, and maybe write down things just to be able to help verbalize them to your loved ones and family as to what your needs are. Being an important appointment buddy, it can be great as a caregiver. Help take notes prior to that appointment, during that appointment, if there's any changes that are being made. The treatment plan, oftentimes when you go in, might have some adjustments. So be there with your loved one as a caregiver to help them take notes and verbalize what you had written down. Make sure that all the questions get answered in the office before you leave, if you have questions regarding changes that might be being made for your loved one at that visit. Some communication tips, again, just, be a good listener, okay? First and foremost, prepare to talk about conversations, have to be open to talk about chronic illness can be impactful to not only communicating with loved ones, but talking about, family finances and, side effects of medication. Sometimes they're not comfortable to take. So make sure that you're able to communicate these types of things amongst your family, with your loved ones, and then with your doctor openly. I'd like to end by reminding you again, I know at the end, before I joined, we were talking about the importance of acknowledging being a caregiver and the level of stress that chronic illness can play on you as part of the family. So all of the things that we talk about for the lupus patient to deal with chronic illness are important for you as well. The nutrition, the sleep, activity and exercise, acknowledging where you feel you are in managing this chronic illness within your family and getting the support that you need, as well as the family member that is suffering from the chronic illness as well. And finally, just some self-care tips again, make sure that you are taking care of your health, that you're seeing your doctors, that you reach out to your healthcare professional if you need help. Maybe you need someone to talk to, a counselor or a therapist as well, to learn how to navigate this chronic illness being a part of your family dynamic. And with that, I would like to mention that I was going to share an opportunity for you to go to a website, the Us and Lupus website, and gain some information relating to caregivers and helping people with tracking symptoms. I would suggest, if you happen to have your phone handy, I would open your camera and hover it over just the QR code on the left, which is, in this case, more caregiver resources. There is a large amount of information there. As I said, a couple on the line today helped put together that information. If you need resources in Spanish, there's a tap on the right where it says Recursos en Español. Hopefully I pronounced that fairly well, but you can actually change the resources that are on the website with the tap of a button right on the screen if you need to access resources in Spanish. But hopefully the resources on that site and educational resources outside of just the caregiver resources will help you with tracking symptoms. You can get a toolkit to help track symptoms and that sort of thing. And if you did not happen to have your camera, that is okay. The usinlupus.com website is one place that you can gather some of this information. So I'd like to thank you for allowing me to share and be a part of the conversation today. Thank you so much.
Thank you so much, Paula. Thank you for that. And I just want to thank our wonderful panelists, Edith and Vanya, and Estella and Juana, and our wonderful moderator, Liz. Paula, thank you again. And thank you to our lupus community for joining us today. Thank you for taking the time. And please feel free to reach out to Lupus LA. And happy to help in any way that I can, that we can. And with that, I'm going to wish everyone a wonderful evening. Thank you again, everybody.
Bye-bye.
Bye.
Thank you for having us.
Bye.
Thank you. Bye-bye.